Hello, good day everyone. I am Maria Ana Katrina Pagal from BSN 111N, and now I am going to conduct the health history taking nursing interview. Good day, ma'am. Before anything else, I would like to introduce myself first. I am Maria Ana Katrina Pagal, your student nurse for today. And you are?
Aileen P. Akal,
Alright. And how would you like me to call you?
my.
Okay, but before we proceed, let me verify some personal information of you. Please state your name,
Aileen P. Akal,
your age,
20 years old,
your address.
Barangay 23, Libar, Piapi.
Okay, so before getting in any further, I would like to know you that in order for me today to help you today, I need you to ask some questions, particularly about your health, your medical backgrounds, and some personal circumstance of you. Will that be alright with you?
Yes,
Do you have any questions?
no.
Okay, so let's get started. So, what brings you here today in the hospital?
I came here today because I have problem with my severe cough.
Okay, how long your calf have been there?
I suppose it's been 4 to 5 days already.
Okay, do you have or get any symptoms about this cough?
Yeah, I have very bad sore throat. It's very itchy.
Okay, so this sore throat has been there a long time with your cough.
Yeah,
Alright, does your cough and your sore throat getting worse at that particular time?
yeah. It's very disturbing every time when I am asleep.
Okay, about your sore throat, will you able to swallow food?
Yeah, I can swallow, but there is light pain every time I swallow solid food.
Okay, can you drink?
I have no problem with liquids.
Okay, about cough, can you describe it?
Every time I cough, I notice that there is free veins of phlegm and it's yellowish and sticky.
Alright, is there anything blood in the sputum?
I haven't noticed.
Okay, so in the scale of 1 to 10, 10 being the worst and 1 being the least, how bad is your cough?
I would say 7 to 8.
Okay, do you feel any pain in your chest, neck, or any parts of your body when you cough?
Yeah, there is pain every time I cough and there is slight difficulty in breathing every time I cough.
Oh.
And I had also pain in my throat.
Okay, so can you point where is your pain when you cough?
I feel some pain in my chest and my throat.
Okay, in the middle of your chest and in your throat. Can you describe the pain? Is it like throbbing, stabbing, or squeezing?
It's like squeezing.
Okay, on a scale of 1 to 10, of course, 10 being the worst and 1 being the least, how bad is your sore throat is?
Since it's slightly pain, I would say 3 to 4.
Okay, have you taken any medications?
2 days ago, I went to the pharmacy. I bought Carbosystem, Solmiox 500 milligram, and also I bought Strepsils to relieve my throat.
Alright, and how many days have you been taking it?
I think 2 days already.
Alright, and have you ever been admitted in the hospitals in some health problems?
No, I have not been admitted about illness or diseases.
Alright, and we don't have any illness such as diabetes, heart problems, or asthma?
No,
Alright, and I suppose you don't have any maintenance medications?
yeah,
Alright. How about allergies? You have allergies about food or pets?
yeah. I have allergies every time I eat shrimp and in pits. I guess I haven't.
Alright, so now let's proceed to the family history since you are not done in pregnancy journey yet. Let me elicit some informations about your family backgrounds. Will that be alright with you?
Yeah, it's okay.
Alright. Does your first relative, such as your mom, dad, or your siblings, have suffered from jaundice,
No,
anemia?
no,
Alright. Heart disease.
I don't remember, but my father is known to have high blood pressure.
Alright. Anyone with diabetes?
Yeah, my dad was deceased to have diabetes.
Alright. Does there is any disease that affected your family?
I don't remember.
And now let me get some of your social status. Will that be alright with you?
Yes,
And do you have any occupation?
no, I'm a student.
Okay, in school, are you exposed to the person or people with fever or cough?
No,
Okay, and in school, is everything alright? No stressors?
I'm just stressed in academics.
Okay, may I ask you, do you smoke?
Yeah,
And how many stick do you consume in a day?
5 stick in a day.
Alright, and do you consider quitting smoking?
Yes, because I realize the smoke is bad in our health.
Well, that's really nice to hear. And if you want to quit smoking, you can come here anytime. We have here a team designated to help or assist you to overcome smoking. And now, do you drink alcohol?
I don't drink alcohol.
Are you in a diet?
I usually eat veggies food.
Okay, and do you often exercise?
I don't really exercise.
Well, I highly encourage you to do exercise because exercising is very big help to improve your immunity. Okay, so we are done in getting some important data, and now I am going to sum up everything we've talked. If I have error, feel free to correct me. Okay, your name is Eileen May Ongkal. You are 20 years old. You live in Barangay 23 Boulevard, Piapi. And are you a single? And you have here in the hospital due to severe coughing. You feel some slight pain in the middle of your chest and in your throat. Okay, and you also feel pain when you swallow solids but not liquids. In this situation, you take a medication of carbocysteine Solmux 500 milligrams for your cough and strepsils for your itchy sore throat. Your phlegm is yellowish and sticky. You feel pain, difficulty in breathing due to your cough. And is there anything else you would like to correct me?
No, everything is correct.
Okay, and now I am going to give this to the doctor, and in just few minutes I will be right back then. I am back, and the doctor gave me your prescriptions, and your meds are as follows. Amoxicillin augmentin 500 milligrams every 8 hours for 7 days to combat the infection, and mucosulpan ambroxol to loosen the mucous secretions. And for your allergies, he prescribed you antihistamine Vitatal. Okay, so you can go home now with your prescriptions, while the doctor wants you to come back here after 7 days for your follow-up checkups.
Okay.
And that would be all.